So today's meeting is very important because this has been the way traditionally in which we've tackled these diseases, and that is one disease at a time. So today's gathering had people addressing trachoma from countries across the Latin American region, getting together to share their experiences and report on progress that they've made to reach the targets for trachoma elimination. But what we found very importantly is that those very communities that are affected by trachoma are also affected by other diseases, which include onchocerciasis or river blindness, lymphatic filariasis, and intestinal worm infections. So the opportunity that we've seen is to actually integrate the response to address these diseases in the same affected communities. So with this trachoma community, we've also presented panels on integration of diseases, and that's using community health workers and instituting policies that actually address 1 to up to 10 diseases that affect the same communities. And these are the poorest communities living on less than $1.25 a day. In Latin America, we estimate over 100 million people are actually at risk of having these diseases, and over half of them are actually children that bear this risk. So when we tackle huge global health problems or public health problems, it can be a daunting task. And the only way we can actually take on these diseases is through partnership, where each partner brings different skills to the table. So in the partnership with the Global Network, with PAHO, and the Inter-American Development Bank, each of these partners have gotten together, bringing their respective strengths to the table. PAHO provides technical assistance to countries, to the ministries of health, on how to actually tackle these diseases and the programs they need to implement. They have strong support from the ministries and strong buy-in to actually address these issues. The Inter-American Development Bank is a solid financing mechanism that is accountable and transparent and has a good governance structure. They also have a very wide footprint across the Latin American region and can provide that administrative support in each country. In addition to that, they have programs on water and sanitation, which are linked to neglected tropical diseases or neglected infectious diseases, and we're working hand in hand with those programs to access these populations. The Global Network is a resource mobilization effort which is funded by the Gates Foundation. Our mission is to raise awareness to NIDs and to build that political will so that governments can institute these policies. So with these three partners, we've been managing to provide a good package of services to and support to national governments to actually institute these policies and roll out their programs. So let me use a very simple example. If we have two villages and we have a river running between them, and we only do programs on one side of the river, treating the people in those villages, what will happen is that those people will get reinfected from the other village that we haven't treated. And so this is the critical point that we're at now, where we acknowledge that we have to scale up the response. If we treat both communities, what we do is we get rid of the parasite. And if we do this over 5 to 6 years, we can actually then eliminate the parasite from the system. And that's the vision which we have with PAHO and IDB to actually work towards. And this is the target for 2015. If we don't scale up this response, we'll be doing NTD control for the next 50 years. But the opportunity now is to actually eliminate these diseases. So the message to ministers of health and ministers of finance is that there are many competing interests when it comes to development and socioeconomic progress. But this is one opportunity that is a public-private partnership with the pharmaceutical industry as well, who are donating all the drugs. Together with support from IDB, PAHO, and the Global Network to actually assist you in accelerating towards this 2015 target. We feel that addressing these NIDs is the entry-level intervention to all other development efforts. If we think about it, if children have the best education and laptop computers, each child having their own computer, if they're not going to school or if they're not strong enough to actually pay attention to their lessons, it won't make a difference. Similarly, if we provide adequate nutrition for these children, but the worms are eating the food, it won't provide benefit for them. So we feel that in tackling neglected infectious diseases, we'll have an opportunity to have greater impact with education, environmental, and other developmental efforts. I think in the way the world is at the moment, we have a collective responsibility to address the predicament and plight of those that are worst off first. I think governments have taken the opportunity to address key constituencies. That's people who live in urban areas and capital cities that are usually the ones who participate in political elections. But what we're talking about with NIDs are the voiceless communities, people who don't have access to water, sanitation, and all these utilities that we living in cities take for granted. So I feel that the greatest gains that we have are when we actually address these communities who live in these far out areas. And this is about addressing equity in the world. And I think we've challenged many divides in the world, politically, philosophically, racially, ethnically. But now we're at a point where we have to actually tackle economic divides. Those people who have things and those people who don't have things. And when we address NIDs, it's actually dealing with these communities. And these are simple solutions. We don't need new scientific technologies. We should always be working on new drugs and a new pipeline of tools. But we have the tools to actually make a difference to these communities. So as a doctor, that would be my primary focus on those communities that are worst off first. From an economist's point of view, it also makes the greatest impact when we have cost-effective interventions and we start with those that are at the bottom, because every gain that we have is a huge improvement in their quality of lives.